Welcome to Vet Life Reimagined. Is it okay to change your work interests? Absolutely. Dr. Christiane Orsini is a great example of a veterinarian who, as she learned more about what's possible in veterinary medicine, evolved her interest and work along with it. Dr. Orsini is a 2014 Ontario Veterinary College graduate. She's currently a telemedicine veterinarian, and she assisted Vets Without Borders in launching and training veterinarians in the Ukraine on using telemedicine to help increase access to veterinary care for pets. She is very passionate about how telemedicine can improve the lives of pets, pet owners, and the veterinary care team, and she will gladly tell you why. On to our conversation with Dr. Christy Orsini. When did you know that you even wanted to get into veterinary medicine?
That's a really great question, Megan. I would say when I was 8 years old, it's just a number that sort of stuck with me. I got my first pets, two family dogs, when I was 6 and 7 years old. So taking on the responsibility and being part of their pet care going forward, attending vet clinic appointments, and just being really invested in how I could care for them and the happiness and unconditional love that they showed me. So that was definitely it. I know that when I was really young, like a toddler, I have a lot of pictures with stuffed animals around me, mainly a panda and like Siberian tiger. And ironically, I didn't really want to be a vet in the regular sense. I kind of wanted to be a wildlife vet or a Jane Goodall kind of thing. But yeah, it turned out to progress in terms of my interests going forward. When I was older, my one dog got congestive heart disease, and so I was wanting so desperately to help him. And so I remember my father bought me a textbook of like veterinary medical care for like the layperson, and it was like a real big textbook, and I was studying everything I needed to know. My father was an orthopedic surgeon, so he was very invested in getting me medically involved. And I guess I got really committed with that. And then in grade 10, I did a civics project, kind of what's our goal in life and what are the steps to get there.
Oh, wow. Well, and it sounds like you explored maybe a little bit into that zoo conservation, but I don't know exactly where that lined up. So, when you went into vet school, were you at that time also thinking more conservation, wildlife, or did that kind of change throughout vet school?
A lot of things did change in terms of my overall interest, but being a city girl, I was sort of, once I got into vet school, I was focused on sort of feline and canine medicine. I realized we didn't learn a lot about exotics, and it would be a whole additional kind of venture on its own and searching for experience. And I felt there was so much to learn for dog and cat, and I wanted to get really good at something more specific. Before vet school, I did volunteer at a private zoo in Eastern Australia. So that was really interesting in terms of getting my hands-on experience there. And then during vet school, I did the East Africa Global Vets Project. So I got more hands-on there. For me, it was sort of more like interest and really cool opportunities that vet medicine presented me versus dedicating my life to that type of medicine.
Well, I'm really curious about that because I looked for those types of opportunities in vet school as well. So you went to vet school in Canada at Ontario, and you went to a really far way to do some of these experiences. So were you just Google searching, or how did you find these types of opportunities?
Yeah, so the vet school student groups had something called Global Vets, and it was a student-run initiative. So we fundraised most of our own money for that, getting the community involved as well, and just educating people about opportunities out there. So we did have previous students from other years that graduated ahead of us, and they came back to share their experience. So there was already projects that were working with different areas. So projects in Thailand, East Africa, South Africa, India, etc. So we kind of followed the lead on that, but we also made our experience and our travels a little bit more personalized in terms of what we want to do specifically and who we want to help out. So that was sort of the initiative. I always wanted to go to Africa. I guess my whole Jane Goodall inspiration from my childhood got me really interested. Unfortunately, we didn't get to go to Congo or anything like that, but we did a lot of work with baboons, not chimps, but we did get some primate experience there.
Very cool. I think the vet school time of your career and your life is really special. So being able to embrace some of those opportunities is really cool. So you said you decided to focus on small animal medicine and you get out of vet school and you go to private practice. So what was that like transitioning from vet school into private practice?
So most of my colleagues also agree with sort of my interpretation. It was kind of like a sink or swim. I started working at a clinic in a remote area, so I ended up having to manage a lot of emergencies. I was obviously you're full of fear and lack of experience, but at the same time you're full of so much motivation. You feel empowered as well, and you're so focused on putting into practice everything that you've learned. So it's more of you want to take on that challenge. For me, I realized that I wanted to specialize more in emergency settings to feel more confident in a general practice. I realized there were so many times where you're doing your regular day and emergencies just come in, like Addisonian crisis or epileptic patients. And I just wanted to be more prepared for that. So I was very motivated to seek that experience. And then I did a 24-hour emerge experience at a different clinic in the city. So it was a high volume for sure. And I got amazing experience there. After that, I pursued locum clinics because my mentor, she definitely recommended and encouraged trying to see which clinic setting would be a good fit for me and my type of practicing as a vet. So it was really neat to get experiences as multiple different vet clinics. I love variety. I think it's a spice of life for sure. And I love that fast pace and that challenge of, there's no plateau because you go in different clinics. You have to kind of relearn their clinic dynamics, their standards, and you're just always on the go, always learning. And what I found most incredible was just to learn from the experienced vet technicians at each clinic and also the veterinary colleagues. It was really nice to network with all of them.
Yeah, I think that's a great perspective. And being able to see how different clinics work, I'm sure you saw when things go well and when things don't. So, from that experience, what do you see as some of the qualities of the clinics that were really successful and the people working there were really thriving?
That's a great reflective question for sure. When I consider that now, I'm realizing just the camaraderie. So just a strong vet team. One of my favorite practices, we always laughed together. We made jokes and kept things light because obviously there's so much stress and compassion fatigue involved in our profession. So I think that was very helpful. They also had a separate like hour for lunchtime. So that was an hour that we could all talk and spend time together, discuss cases, or just even rest. I think that was very important. A lot of clinics, well, I wouldn't say a lot of clinics, but some clinics I did work at, there was a lot of, we're going to push through lunchtime. And so I was going to be one doctor, one tech, and one clinic staff on. And then we kind of rotate just so we don't miss anything in the day. And that's obviously helpful for high volume practices, but for the clinic dynamics, I think it makes things a little challenging for bonding because most of the time you're very busy, you're focused on what you're doing and your task. And then after hours, you don't want to kind of hang out with your work family. You want to hang out with your nuclear family and your friends. So I think the camaraderie was a big thing. And also just kindness and respect. So no matter what level you are, whether you're a vet or a manager or a technician or receptionist, everyone should be given equal respect.
Oh, yeah, I completely agree. I think that is a beautiful observation as well, and good things to carry in all aspects of your life. Now, one of the things that I was really interested in with your background is you've done so many different things within veterinary medicine and your career. So, One thing that you've done is you got a certification in canine integrative rehab. How did you start to go from the emergency work into exploring some other things? Like, one, why did you do that? Was there you just wanted a change? Like, what was that motivation? And then what was that path?
Yeah, that's it's an interesting path for sure. And I'd say overall, again, instructions and influence from my mentor said, for the first 5 years of practice as a vet, you want every experience you can doing conventional clinical medicine, because that gives you a really strong foundation, and then you can sort of spread your wings from there. So I was definitely focused in the first 5 years to do that. And then I guess I was getting really antsy to pursue integrative medicine, just because I thought it was such a beneficial avenue and additional modality for caring for our pet patients. So I think in the fourth year, I started to get interested in pursuing that more certification process. So I actually worked with the College of Integrative Veterinarians, veterinary therapies, and it's based out of Australia. So everything is conducted online. So I do have my full certification of my veterinary acupuncture as well, and then my canine integrative rehabilitation. So for me, I think hands-on, especially with those modalities, is still very important. And in between, I guess one of my rotations in fourth year, I went to Atlantic Vet College in PEI, Canada, and I had an amazing mentor, Dr. Ortenberger. He's phenomenal, and he's actually an equine surgeon. He's retired now. There was a lot of cases that he wasn't getting proper response from conventional medicine, and so it caused him to research, and a lot of his colleagues in Europe were practicing acupuncture and chiropractic medicine for equine issues, and he was seeing a lot of success. So he sort of got himself certified in both of those, and he was a huge inspiration for continuing to pursue that for myself. Why was I initially involved in that rotation? Because I have an injury in my right wrist, my dominant wrist, from 2006, and from a basketball game. I needed surgery, and I had torn all my ligaments. It wasn't fracture. So it was a really intense injury that took 7 years to have minimal pain with. And the surgery corrected a lot of pain and mobility issues, but I had a lot of scar tissue and a lot of restrictions. So I pursued acupuncture because my good friend is a naturopathic doctor and recommended it. And since then, it's given me a new life. I can play on my sports and music again and do surgery. So that's obviously a gift. And I just wanted to think that, if there's certain cases or situations where conventional medicine is just not responding for those pets, I do want to give them other opportunities to basically heal really well.
Yeah. Do you have like a favorite story you like to tell where you saw integrative therapies make a huge difference in a pet's life?
Yeah, that's they're always kind of miracle stories. So often people come in, and pet parents are so distraught, and like, we've tried everything and nothing's working. So there's this one case where this dog would vomit and then seizure, and it was just highly connected. And in my studies in Chinese medicine, because I did a lot of herbal medicine and in the acupuncture certification, and we learned that there's a connection between gastritis and food-based allergies, causing inflammation and leading to seizure activity. And so there was an herbal formula that actually focused on this specifically, and it worked really well for the pet. So the pet wasn't on any typical anti-epileptic drugs. It was just on the herbal treatment. So obviously, I do highly recommend integrative therapy, not just Western or just Eastern medicine, but I obviously want to collaborate with the pet parent, and that was their goal and focus for managing their pet. For the integrative rehabilitation, there's fantastic evidence out there. One of the case studies during my course talked about how there was a severe IVDD dog who had, the injury was already really old, and they tried to manage it conventionally but weren't able to afford surgery. And then so they initiated acupuncture and rehabilitation. And it did take 12 months of recovery, but the dog was able to walk on its own and run and play. Obviously, still really ataxic and not normal gait, but really improved quality of life. So that was really astounding for sure.
Oh, I love those. Have you seen a rise in interest among pet parents with using different types of therapies with their pets?
I would say absolutely. I know that for the trend of human medicine and just everyone's awareness for food and diet health, as well as exercise, I think it's really becoming in terms of increased awareness, especially with the millennials, right? All the millennial parents definitely want to search at all the options exhaustively to make sure they're doing everything they can for a baby who's a part of their family. And it's beautiful to see people's motivation and dedication to having their pets live a healthy life.
Yeah, I agree. I think there'll be more and more opportunities for veterinarians also to specialize in different areas and offer alternatives to really support pet owners going through that. If they want to explore options, I think it's good to know what those options are, at least know people to refer to. So it sounds like you're really passionate about integrative rehab and working in that type of medicine. So what kind of inspired you to do some more career transitions?
Yeah, so I was definitely dedicated to pursue that long term, but then COVID happened and it changed a lot of dynamics with my personal life. So I sort of put that on hold for now, and I pursued after my mat leave, I pursued telehealth and then transitioned into telemedicine. I knew I would like it, and I for me it was more of a temporary option, especially with just working remotely being convenient for my family life. But that's developed into a very unexpected, intense passion of veterinary telemedicine and something that, I didn't predict, but I absolutely love. And it's the best job satisfaction I've ever had. So I'm definitely continuing to go this path, and wherever it leads me, I'm definitely happy here.
What is it that has sparked this surprising passion in telehealth?
Yeah, so for my personal experience, I'm doing specifically telemedicine. So I am able to prescribe medications, to request diagnostics from the local vet clinics, and to follow up with patients. So that clinical care really mirrors the in-person clinical care that I've always loved so much. That's a gift for sure. And the ability to connect with pet parents virtually and even have patients respond, calling their name or the little cat call for the cats, and they just like look at you and or sometimes ignore the video, but most of the time they're very animated and involved, and it's still really cool connection. Yeah, you can't pet them, I can't hug them, but I can still connect with them, and that connection is a lot more rewarding than I would expect virtually. So that's been a blessing. And for the client point of view, especially with all that curbside medicine that we did for so long, I feel the clients had a big disconnect with being able to reach their vet personally and speak to the vet one on one. So to give them that option of like just undivided attention, that one-on-one time is really a gift and an advantage for improving the bond with the client and the pet.
So you joined Smart.vet and you were talking about this virtual consultation with the as in like video virtual consultation with a pet owner. So do you mind explaining a little bit about what your work life is like and how you're using telehealth? Because telehealth, telemedicine can mean a lot of different things. So I'm curious if you don't mind kind of sharing what yours looks like and why you like this particular method.
Absolutely. Yeah. So I started with Smart Vet over a year and a half ago. And What we do is we work with local vet clinics and emergency and referral hospitals for patient care. So if there's an overflow for emergency care, or there's a backup due to vet shortage, which we see a lot, then they will be redirected to our services and then schedule a phone or video consultation. At that point, we do the consultation. It's live, it's on demand. Some of them can be scheduled, but mostly it's on demand. So I'm working a set shift and calls will come in to me. So I'll claim the call, I'll review the history that my technicians have wonderfully put in for me. Typically we have an amazing RVT team, and they typically book most of our calls, but clients can also book directly. So I have the information, so the signalment, a brief history, and then I start the call with the client. I typically go over a little bit more history, ask some more open-ended questions, and just make sure that I understand the exact concern that they're presenting with. And then proceed to do a visual assessment. For the visual assessment, I guide the pet owner to do a physical exam on their own pet. So this is a really cool opportunity to help the pet owner in education of what to look for, even for a healthy pet. It's great for them to be involved as the doctor at home that they are. So we'll check the basic things like respiration rate. We'll teach them for abdominal palpation. Usually if there's a potential injury, I include neck and spinal palpation as well. Obviously do cap refill time, look at eyes and ears. If the patient is vomiting, with history of vomiting, and the patient is not in distress, then I do encourage the pet to actually look in the mouth. Is something stuck? Is there an issue there? And then I encourage the pet owner to put their pet on the floor and have them walk around the room, just so I can observe overall strength, mobility, and just overall behavior for the pet. At that point, we discuss potential differential diagnoses, and then we make a treatment plan. So for some pets, depending on if it's overnight or if it's on a weekend or holiday where their local vet is not open, we can't necessarily request diagnostics. So we can do those at a different day. If it is a true emergency, so respiratory distress cases or seizure cases, most of these are triaged by our technician team beforehand, but some are still quite urgent. And for those, we do recommend transfer for in-person exam, diagnostics, and supportive care. So if these pets need IV fluids and hospitalization, if they're projected vomiting, oral meds aren't going to cut it, we definitely want injectables in those cases, or if we definitely need an X-ray or in-person IV medications. So those are typically the criteria. If a pet is not able to stand or walk on their own, or their pain is very severe, obviously we can't prescribe opioids over telemedicine in most jurisdictions. So in those cases, I do recommend hands-on care, mainly for pain management. And then if the pet is stable or otherwise manageable with medications, so if there's an eye infection, ear infection, if there's a kennel cough, those sort of things, or a mild puncture wound, we could prescribe pain meds and antibiotics. And so we can send those prescriptions to the local human pharmacy, or we can send them to the local vet clinic, and whatever clinics are able to work that into their schedule. It's very helpful. So we could provide overall normal clinical care, and we can do thorough management of these cases.
Hey, thank you for watching Vet Life Reimagined. This is still a growing channel on YouTube, so liking the video, subscribing to the channel, leaving comments, and sharing the show all go a long way right now, and it is all seen and appreciated. I still have over 40 guests and many more videos on the channel that you can go back and listen to, like Justine Lee, i.e. Vet Girl, Dr. Brent Mayab, Alyssa Mages, Rob Trimble, Megan Parks, and many more. I've created playlists for you so you can dive in. You can listen to veterinary technicians, veterinarians, veterinary students. You could discover all of that and more if you go to the main page of the Vet Life Reimagined YouTube channel. The link is down below if you need it. Now back to the conversation.
For some cases that I'm concerned of, if the pet doesn't have a family vet, again, there's a shortage and a huge wait list. So for those cases, we do follow-ups to make sure the pet's doing okay. Typically, though, we advise all of the pet parents to return to care with their family vet the next day. We send all the records ahead of time, so that knowledge is is mutual, and we reiterate with everyone, we're here when your vet is not available, but we want you to keep that established rapport with your family vet.
Nice. Okay. In the United States, there's a very large range of thoughts and feelings when it comes to telehealth, and it can be a little confusing because each state in the United States might have slightly different regulations. So, have you encountered people with concerns with telehealth? And if so, what are probably some of the biggest concerns that you hear about?
That's a great question and comment, and I'll be the first to say I was the first person to have concerns that I knew of. So I was initially hesitant to start virtual medicine. I felt that, we definitely have to have a hands-on exam. We definitely have to do diagnostics every time to practice, gold standard medicine. But as I started to work, there's so many people in really remote areas without cars, elderly people that can't move their pet if it's in a lot of pain, really reactive, stressful, aggressive pets that the owners are having really difficult getting into the car. And obviously, we do want to work with overall behavioral issues with their family vet on a general basis. But in times of emergency, if they can't spray feel away in the cat carrier, they need to get to the vet. And there's so many distraught pet parents, and there's so many animals suffering. And so I learned that even if we can't do gold standard, we can still do something. And so whatever that something is, again, you have to make sure you're following the regulations in your district. So if that's strictly just telehealth, then just making those recommendations or just being there to listen and support the pet parent. If that's telemedicine, then yeah, we're going to start treatment right away. So I was definitely hesitant and skeptical at first, but it didn't take me long at all to realize that a lot of cases in the clinic setting, there's still aggressive pets, there's still people with cost restraints. So we can't even practice gold standard anyway. It's always good to educate what we would like to do, but there's a lot of limitations, and very small percentage we actually get to do the full myriad of diagnostics and treatments in practice. So I felt that it's more of that incremental vet care we're providing. I think there's a lot of hesitation, basically, because it's changed. Change involves more education, change involves a new way of practice, change involves new experience, and that initial sense of discomfort and anxiousness of managing pets from a distance, remote. It's not comfortable at first, but then once you get the hang of it, just like any change, it's so incredibly transformative and very impactful in the vet community.
I like that. And I know that Canada is a little ahead of the United States when it comes to, telehealth and telemedicine. So I think it's great to hear different perspectives of it. And honestly, I think it is helpful that you were kind of skeptical at first, but, like you said, you've gone from skeptic to, advocate. Really, it sounds like you started this for you too, as a lifestyle that you were looking for in a different way to, that dream of taking care of animals, but also taking care of the family in your way too. So, how has this really impacted you in your values and kind of what you see as your career goals?
Yeah, that's a great question. And when I just think about what telemedicine has done for me, I can't stop singing its praise, really. It's given me kind of a new life, obviously new lifestyle, new way of practicing medicine. But the volume of cases I get to see, the number of patients and pet parents I get to help, impact, and connect with on a daily basis, like I'm already at over 3,700 cases in just a year and a half. So it's so impactful for my life. The job satisfaction is really huge, and just seeing the pets that I'm taking care of, it's not just a phone call. Most of the time it's video, so seeing them on the video and really just observing that human animal bond, especially in their setting of their own house, it's really a gift to be able to see their connection and because we have that kind of intimate platform, there are a lot of clients who open up a lot, that this is the pet that is left over from the deceased partner, or this is their, the only thing in their life that gives them unconditional love. You see the big picture, and then you can actually separate, this is not just medicine I'm doing. This is like really, really amazing work I get to do. It's an absolute blessing to be able to help strengthen that bond between the pet owner and the pet, and to help the pet so that the owner can feel good too, and relieve their distress. And obviously there's cases where it is very traumatic. The situation is very grave, but just to walk the pet parent through that and just to be there for them, that's been life-changing for me for sure. And I'm just so grateful I get to be a part of it. My biggest focus right now is veterinary wellness, and especially to know that we're not only helping the pets and the pet owners at large, we're helping the vet community. There's so many vets, burning out from compassion fatigue, lifestyle changes, even suicide, sadly, and they need extra support because we're all so caring and so giving. And so we'll work all night, and then we'll work straight the next day, a whole shift, just to ensure that we can help more patients because there's so many in need. So to be a part of, different practices, veterinary wellness, that's a real blessing and gift. I think that's definitely the reason why this is such a passion project of mine, and very long term, because I do want to encourage the veterinary community globally that veterinary telemedicine is an amazing addition to veterinary practice, and it's so necessary. If it wasn't necessary, we wouldn't be so busy and we wouldn't be changing people's lives. We've gotten so much feedback from vet clinics in remote areas, saying like, I can finally take a day off, I can finally be with my family or sleep at home for once. And it's life-changing. And again, if we don't have vets who are healthy and who are in a good place, then our pets are going to suffer, and the pet parent relationship with their pets are also going to suffer. So I think telemedicine is a gift, an additional modality, and definitely a bridge to help everything that the vet industry is going through kind of currently and long term. It's definitely not a transient modality. It's here to stay.
So what do you see as the future for whether it's veterinary medicine in general or telehealth in our industry? What do you kind of see as the future of the veterinary medicine that is kind of exciting for you?
There's a lot of excitement for sure, and just seeing how successful it has been. And for my point of view, it's very accurate and effective medicine too. And so just to make sure that we continue this, trajectory that we're on, and just see where it takes us, just be open to whatever it brings in terms of supporting the vet community, I think is very important. We don't have to put ourselves in a box. We can continue to open up our awareness and continue to educate veterinary professionals and also pet parents that, just like human medicine, we do have other options, and we want to be able to support everyone. And this is a way that we can. So it's exciting to see what changes are going on globally. And it's really interesting and awesome, really, to be able to connect with veterinary telemedicine vets all around the world, really.
Are you able to bring in any of the integrative medicine into what you do now?
So in terms of integrating, Eastern and Western medicine, I think that I do a lot of discussion with the pet parent in terms of rehabilitation options to do at home. Most lameness issues, I always recommend, cold or warm packs. In addition to that, massage-based therapies, gentle, passive range of motion, and just anything they can do to help their pet. Nutritional recommendations, I'm sure that you have a lot of amazing insight for, but I do try to make sure diet and nutrition is talked about. And behavior modification recommendations. There are acupressure points that I can recommend Obviously, the owner can just use their finger and press more firmly on the area. Again, this involves more communication, more education with the client, and they want to have invested interest in that. But for most of the time, our volume is very high, so we don't have extra time to talk about all these other options. But I do recommend for the client to pursue if there's a specialist in their area that can help them with that, because for certain conditions I would say, yeah, this would respond very well to acupuncture, or this would respond very well to physiotherapy and rehabilitation. So I think that's it's always a great conversation to have. And again, no matter what our journey has been, all that experience and all that education is always going to bring us transferable skills and extra knowledge to share with our pet parents.
Yeah. And I mean, I see such advantage of having this as a video consultation, but I wonder, do you ever get people who are hesitant to do it if it's on video?
It's mostly, I think, no, people really want video time. They want it even if
Okay.
it's a simple like suspected UTI. They want you to look at the pet because they want that complete care. I think the only challenges and obstacles we come across is if there's internet connection issues in remote areas and technical problems. But overall, most people, I'd say 95% of calls are video, and that's requested by the pet owner.
Okay. I didn't know if anybody would be like, "Oh, I don't want them to see my house," or I don't know.
I get a lot of those comments. They're like, "Oh, my house is messy." I'm like, "Please, don't worry about that at all. Our focus is, seeing your pet in its environment, and it's actually helpful, especially when we talk about like litter box literacy. Like, is there more than just that box there, or where the water bowl's kept, and things like that." So, I think that is helpful.
Yeah, I can definitely see it being helpful. Very cool. Well, what else is on your mind these days with when it comes to veterinary medicine that you think maybe we don't talk enough about?
So overall, veterinary wellness, I think that work-life balance thing is kind of a myth, and I've read a lot in it, and Dr. Marie Holloway Chuck talks a lot about that as well. And it's amazing to see the revolution of veterinary wellness and the people's interest and dedication in that and focus. But at the end of the day, we have to really focus on our personal goals and our, I guess, working with our mind and how we can leave work at work and come home. So for me, if I work from home all the time, there is a little bit of difficulty leaving those cases behind because I'm physically in the same facility. So for me, I have to learn to distance myself from cases once I've sort of closed them off. I can do my follow-up, but then I have to let that go. I have to let their family vet deal with that. So I think it's complicated in terms of training yourself to not care so much, and to not hold yourself accountable for all these pets. Our goal is to do interim medicine. Our goal is to bridge that gap, and we can't completely cure all these things, and we can't ensure long-term management, just like we can't ensure client compliance. We can only do our best, and then we do have to let go at some point.
Yeah. So what do you see as your kind of potential future in your career? You've been with this company a year and a half, but you've kind of shown you like to grow and maybe try new things. So have you thought about that yet, or is it too soon to look at some other kind of your personal future?
Yeah, I and we can't guarantee anything in life, but I'm highly, highly likely to stay with telemedicine, at least in some capacity, my whole profession long, because I just have such a passion for it. My kind of new venture is public speaking, to encourage veterinary telemedicine nationally and also globally. So that's definitely where my projected interest is at this time. And I'll be speaking at the Western Canada Vet Conference this coming fall. And so I'm doing a 6-part veterinary telemedicine series of lectures there, which is really great opportunity. I've spoken at a few other vet conferences recently as well, and I just see so much importance in the need for educating the vet community, because there's still so many questions. There's still so many unknowns and uncertainty people have because they either don't have direct experience or they don't know about what options are available. And there's a lot of services available. There's a lot of opportunity to integrate telemedicine into your own practice. And I think that education piece is so important. That's the only way that we're going to make sure that change is permanent, is if we educate the reasons why it's so necessary, the reasons why it's so effective. And the biggest thing is access of care. So we're seeing all these sort of holes in veterinary medicine in terms of access of care, again, for a lot of vet shortage reasons, but also people in remote areas. So I get to care for pet parents who live 5 hours from any veterinary practice, so instead of them feeling completely at a loss, you're helping a little bit. And again, that extrapolates to the confidence and the trust that pet parents gain with our vet community. Like, wow, they're going the extra mile to meet me where I'm at and to help me and my pet. And that means the world to them. So not only increasing the human animal bond, but that veterinary client patient relationship is so necessary. So again, I love public speaking. I love networking. I love connecting, and combining that with my passion for telemedicine is definitely where I see my future.
Oh, that sounds like very exciting. I can't wait until maybe we can get you down and get you to a VMX or another conference here as well. So I'm really
I would love
excited for
that.
you. Yeah. Well, definitely make sure to send me any links that you would like for me to share in the show notes so people can find you and learn more about telehealth. So we'll definitely make sure to do that. But before I let you go, we have a final 4 questions. And the first one is, what is something that people may get wrong about you?
Just underestimate me, I guess, because I just feel I'm a very driven person. And so my mom made a funny comment the other day because she asked me how my day was, and it was only middle of the day, and I told her what I'd done. She's like, how many hours are in your day? So it's just more like I'm always on the go and I love doing everything. Different interests of mine that people might not know of is I'm very passionate about music and poetry and sports. So I spend a lot of my free time doing those.
And actually, that was the second question is, do you have a hidden skill or interest? So when it comes to music, do you like play an instrument? What do you do with music?
Yeah, so full drum set. That's what I started when I was 11 years old. And I wanted to be a rock star, and then I got a wrist injury. So yeah, my plan A was to be a rock star. But since then, again, because of acupuncture, I have my wrist back in terms of doing sports and music. So I play guitar, piano, and drums. I dabble in other percussion instruments and ukulele and things like that. And I play a lot of squash. I swim. I read a lot. I love books, and I write poetry.
Wow, you are like multidimensional. I love this. And I would not have penned you as a rock star. So I love this. Actually, being underestimated, it can be a good thing. So I think that's awesome.
Yeah.
My third question was, is there something on your bucket list that you would like to do?
Well, I've already been skydiving. That was kind of my main bucket list one. That was a long time ago, like 15 years ago. But I want to, I climbed Mount Kenya when I was in East Africa, and that was an incredible experience, a very scary experience. But I would like to hike the mountains in Patagonia mountain range in South America. And then I would also like to do the Swiss Alps, France Alps, and Austria.
Now, it sounded like there was a story there. Why was it a scary climb?
It's not like Kilimanjaro. Our mountain guide, whose name was Moses, ironically, he had hiked Kilimanjaro so many times, but he's done Kenya many more times, and described the differences. And obviously, Kilimanjaro is higher; it's definitely really intense still, but it actually has a path most of the way up, and Mount Kenya it's more cliffs everywhere. And so I was physically I was prepared, but you can't really train for that kind of exertion. And then to have cliffs everywhere was just terrifying, really. I'm very happy I'm alive. At the top of the mountain, they had a plaque saying, this plaque is dedicated to Dr. So and so, who lost her life descending this mountain. And I was like, wow, what encouragement.
I was just say, it was
I
scary
had to
enough
pray
going
the whole way, the whole way.
Oh, goodness. Well, it sounds like there are many adventures waiting you. But finally, the last question is, what is something you are most grateful for?
I'd say, well, definitely my family and my pets, I'm most grateful for. But I'd say I'm doing a lot of self reflection and focus on self love these days. So I'm actually grateful for myself in terms of the perseverance I've had through the vet profession, because it's not been easy. I'm sure all of our colleagues can relate. And just the fact that I did hold on, and then now it's just blossomed into this most beautiful profession I could ever imagine. So I'm very grateful for that.
This has been the Vet Life Reimagined podcast. Whether you are listening or watching on YouTube, I hope you enjoyed this conversation. Please make sure you are subscribed to catch all these amazing people in our profession. Also, send this episode to someone you think who would appreciate it. Have a recommendation for someone who would be a good guest? Please reach out on LinkedIn, Instagram, or Facebook. There aren't that many Dr. Sprinkles. Until next time, Vet Lifers.